Well, my name's Dr Adam. We're coming live today with our third Q&A session from Green Cross Vets in Chatswood. Today we have to talk about a very, very important topic, everything about senior, your senior pet, your senior dog, your senior cat. I have a question about a senior rabbit as well. Please make sure that you fill your questions in, comment section down below, and we're going to have an awesome session today about Q&A. Again, I'm Dr Adam. I've been a vet for about 18 years. We're coming live again from the Green Cross Vets in Chatswood, talking about everything senior. So please forward your questions along. I'm very happy to answer them going through for the day. Seniors is very, very important. Obviously, as humans, we age, and of course our pets age as well. So when we say when is a dog a senior and when is a cat a senior, what do we mean by that? What do we mean by a senior dog or a senior cat? In cats, it's quite easy because a senior cat is generally defined as a cat above the age of about 8 years of age, give or take 8 years of age. In dogs, it really depends on the breed of dog that we have, or that you have rather, in terms of what is a senior. Generally, we speak about a dog being senior above the age of about 7. Now, I must emphasize, guys, it's really important that a senior Chihuahua and a senior Great Dane is a little bit different. We tend to use 7 years of age in a dog as a ballpark figure. A senior Great Dane is a very, very good Great Dane. A 7-year-old Chihuahua, there's a lot of life and longevity left in there as well. We tend to say about 7 years for dogs, give or take 8 years for cats. There are many problems that we can face and that we do face in our senior patients. Some of the common health problems that we do face is arthritis. Arthritis, what we call degenerative joint disease, is very, very common in our senior pets. They get sore, painful joints, often sore after walking or when they're resting, for example. They get up and they are quite sore, difficult jumping onto couches and beds. We also see a lot of pets develop lumps and bumps on their skin, on their coat. Take a message, please. Any senior pet, or any pet, doesn't matter if they're senior or not, if there's a lump or bump on them that you're feeling with them, it's not normal. And if it's not normal, please make sure you go along to your nearest vet, have that lump checked out, get them to take a small sample from that lump and have it checked out. A lump or bump is not normal, and it's so common that we do see in our senior patients. Please, take a message from today. Senior pets get lumps and bumps and they need to be checked out. It's really very, very important. Other things that we do see in senior pets that do start to cause a concern, of course, is liver disease and kidney disease. We know these are very common in our senior patients. We also see heart disease creeping up as well. I have my first question come through. I think this is from Jean, I believe, as well. Thanks, John. The question is, Harley, my mouse Steffi is 10 in June. He has arthritis and takes Foresight. It's working, but is there anything else I can do to help him? Should I get him a coat for winter? We live in Brisbane. There's another question to that, is about a young female dog that's in the house that they're biting or sniffing. Foresight is a very, very good product. It's a form of joint supplementation. He has arthritis. Most important with Harley, that he's assessed that he's a good body weight. There are so much more things that you can do for Harley in conjunction with Foresight. There are some awesome diets that are available: physiotherapy, acupuncture, modified exercise. Definitely the warm coats would help, good bedding. There's so much things that you can do, so many things rather, that you can do for Harley. It's very important, please, John, to have Harley assessed by a regular veterinarian. This is very important. 10-year-old Steffi, it's a good age. I believe the oldest Steffi I've seen is probably close to 16, 17. So there's definitely a very good hope for young Mr. Harley. In relation to Harley nipping your other 11-month-old female, your female Steffi at home is probably wanting to play. She wants a bit of TLC, wants to play, chase a ball. Harley mightn't be in that frame of mind, and he could be sore. He could be in discomfort, not able to move around a lot. I would definitely check with your regular veterinarian as well. Very important. These behavioural problems that we do see in senior pets are addressed. It's a great question. Thank you very much. Again, guys, we're coming live from the Green Cross Vets in Chatswood today. I'm Dr. Adam. We're talking about all things senior today. There's a section in the comments down below. fire all your questions. I'm sure there'll be hundreds of questions today, and very happy to answer all your questions, of course. Thank you for that. Other things that we do see as pets become older and senior is they do start to lose the visual acuity or the accuracy of their vision. You might notice their eyes might start to turn a little bit white inside. They might have the accuracy of their vision. We certainly see hearing loss, and we certainly see dogs that have what's called cognitive dysfunction syndrome, or what we call canine cognitive dysfunction syndrome, not dissimilar to doggy Alzheimer's or Alzheimer's in humans that dogs get also. So these are very, very common things that we do see in our senior pets. A lot of people will take these as an aging process, and it's true, but we can help these dogs. We can help these dogs and help these cats lead better, healthy, happier lives that are really, really pain-free. Other things in their pet's behavior that we do see, apart from the hearing loss, apart from the vision loss, some pets can become quite sore. Again, soreness can be due to arthritis. You might notice when you're patting them, they could be a bit tender along their back, along their joints. They might have difficulty in jumping up on couches or beds. Cats especially. Biggest thing in cats is that they do have problems jumping up on couches and beds. They can be in a bit of discomfort, and some cats just won't like to be touched. In cats especially, they will often find it difficult to groom themselves, and you might find in cats their coat's matted. They have difficulty in turning around, their lumps and bumps. When you go and try and brush them or groom them, they're going to be a little bit tender and a little bit sore. So please be careful of that. It's incredibly important. A common question is, I know my pet is getting old, or what we say senior. How do I keep them healthy and happy for as long as possible? Aging is inevitable. We see it in us. We see it in our pets as well. The best way to keep your pets healthy is make sure you see your regular vet at least twice a year, or any time that you are concerned about their health. Even if you think that they're doing okay, go and get an expert opinion. Go get a professional opinion. Regular checkups are very, very important. Early detection of disease, heart disease, liver disease, kidney disease, for example, any lumps or bumps. It's so much easier to deal with this right there and then, rather than waiting for it to develop. Again, see your regular vet at least twice a year. Take your pet too, of course. Another question that's come through. This one is from JB Jules, also a Steffi. We see a lot of Steffies, and they're fantastic dogs. JB Jules writes, my Steffi is 11 years old and has fatty lumps. Should I be concerned? Very common to get fatty lumps in dogs. Less common in cats, but a lot more common in dogs. As long as the fatty lumps have been diagnosed as a fatty lump and not just felt and guessed as a fatty lump, that's okay. Some fatty lumps can grow, and lipomas, what we call fatty lumps, can grow very, very slowly. But if they grow fast, or they have different textures, they become red or inflamed, they're probably not lipomas, or they've changed into something that's different to a fatty lump. Take home rule, any lump or bump must be checked by a veterinarian. Don't be afraid. Take your dog, take your cat to a vet, have them assess it. Make sure they do a biopsy. It's easy to do, it's economical to do, it's easy to do. We generally have the results on the day. If not, they're sent to a pathologist the next day. Any lump or bump. Your recommendation to JB Jules regarding your Steffi, please take your dog to a regular vet. Any lump or bump has to be assessed. Great question, guys. Again, I'm Dr. Adam. We're coming live from the Green Cross Vets in Chatswood. You see a cat behind me giving us high five. Hey, high five to you guys. Please continue your questions coming through. Don't be shy. Write them in the comment section below as well. How common is cancer in older pets? This is a question that's come through. How common is cancer in older pets? I don't have any statistics for you in terms of percentage, but the older the patient becomes, the more likely we do see cancer. Now, by definition, any lump or bump is a form of cancer. It's an unusual lump or bump. It doesn't mean it's going to be malignant or it's going to be benign, but it's very, very common. We see mast cells in dogs, very, very common. We see upset stomachs and intestinal growths in cats as very, very common. we see lymphoma, we see all sorts of cancers in dogs and cats. We know very clear that early detection, early diagnosis and early detection is the key to making sure that your senior pet has got the best chance of quality of life that they can have. A senior pet is very common and they are very much part of the family. Really important that we take care of them, we nurture them, we involve them with our family in what we do on a day-to-day basis. Another awesome question, guys. That's great coming through. This one is from, I think, maybe Chris Hill. Very good question about joint supplements. Do they actually work? Joint supplements do work in combination with other therapies. Alone, they're good. There's been some quite new data that's come out regarding certain products with joint supplements that is actually pretty good. But in combination, they work better. In combination, we mean good diet. There are awesome diets that are available to help with arthritic disease. A lot of our senior patients, unfortunately, are overweight. They're overweight because they have difficulty moving. But we feed the same amount of diet or the same calories in that diet, and they do become a little bit overweight. So there are some fantastic diets that are available that will not only help with arthritis management, but also weight loss. Again, it's very important. So joint supplementation works with good diet control, with good exercise modification. Certainly we need to use periodically anti-inflammatory pain control medication. That's really important. And I think that will give your patient, your pet, probably the fastest degree of relief is to use some sort of anti-inflammatory or some sort of pain control medication. Joint supplements work, take a bit more time. There's a lot out there, but generally they are very, very good. Great question. Thank you very much. Next question from an unknown person is, again, thanks for that. It's really great. If my dog loses its hearing, is there anything that can be done to restore it? Very good question. Very, very good question. Depends on the cause of the hearing loss. If the hearing loss is due to aging process, then there's something that's not easily able to be restored. If it's due, and I'll come back to it in a second. If its hearing loss is due to underlying disease process, and there are certain medications that we know will be toxic to the ear, sometimes it's reversible, sometimes not. If it's due to aging process, generally no, there's not a lot that you can do about it. However, there is available, and it sounds bizarre, but there is available little hearing implants, little cochlear implants that are available for dogs that have shown some very good benefits in helping to restore hearing for those dogs that are hearing impaired. Definitely would be something a specialist would need to attend to, maybe even at a research facility, maybe even a university would have access to the technology. But I think those hearing implants, certainly when I went through uni, we were looking at those as part of our training as well, but definitely worthwhile looking at it. Awesome question. We know in the human world, implants are very, very common, but also they should be available to some extent in our world. Awesome question. Okay, my senior hound. This is a question from Sheila Ann. I guess. Thank you for that. My senior hound has a lump near her eye. I'm worried about her having surgery at her age. Should I be? Very, very good question. Very, very common question. It really depends on how young she is or how old she is. It's going to sound strange, but age is not a disease. You won't find age in a textbook, in the veterinary textbook, about age being a disease. Don't let age set you back. If she's senior, has a good physical examination, has some blood work done, make sure everything's done properly beforehand, there should be no inherent greater risks of a senior pet. Now, obviously, there's senior and there's senior. If your senior dog is 15, 16, 17, it's a little bit different from being 8, 9, 10, 11, 12. Generally, these lumps can be looked at quite easily with some heavy sedation. But again, I would check with your regular veterinarian about having her looked at. Don't let the lump get too big, especially near the eye where there's not a huge amount of skin to deal with. Please have it checked out. Guys, these are awesome questions. A couple have stumped me a little bit and got me thinking, which is great. Please keep them questions coming along. It's really good, really challenging for me to have these questions. Again, I'm Dr. Adam, coming live from the Green Cross Vets in Chatswood today. We're talking about everything senior, so please don't hesitate to fire your questions my way. I'm happy to answer those questions. A non-senior question. This is somehow that got into my mix. My 8-year-old cat has dental disease. What's the best way to keep his teeth clean? The best way, this is from Emily, I guess. Emily, thanks for the question, it's really great. 8-year-old cat, definitely in that senior category. The best way to keep your cat's teeth clean is to have his teeth assessed by your local veterinarian. If the teeth are not white, then it's not normal. They need to be white. Yellow teeth, they need to be assessed by a vet, have them cleaned, or have a diet modification, depends on the degree of yellowness. There are some fantastic diets available. You can brush cats' teeth, you can brush dogs' teeth. A little bit harder in cats that are 8 years, even above 12 months. It's a little harder. Answer your question, in good health, the best way to keep dogs' and cats' teeth clean is to definitely brush good quality dry food as well. 8-year-old cat, have them assessed by your regular veterinarian. Very, very important for this to happen. Very good question coming through from Canine Battle Beds. This is a very unique question. It's quite unique to German Shepherds. The question is, what are some tips for dealing with canine degenerative myelopathy? Would love to know, as a shepherd is currently diagnosed with it. Guys, and girls of course, canine degenerative myelopathy is a degenerative condition that we see in dogs, particularly German Shepherds, where the lower part of the spine or the spinal cord starts to degenerate, one of those words. As it degenerates, these Shepherds have difficulty in walking, they can be quite sore. If diagnosed, there may be a surgical technique approach if the vertebra pressing on the spinal cord. CT, preferably MRI, is the way. There are medications that can help with this condition. Generally, it's supportive. I believe acupuncture can help relieve some of the discomfort. Physiotherapy, joint supplementations. Regrettably, this is a degenerative condition. Regrettably, it will get worse. Unfortunately, it is a common thing that we do hear about and sometimes see in Shepherds. Don't let it put you off seeking treatment. It's very important to seek treatment and seek assistance. There are some fantastic clinics with treadmills, underwater treadmills that can help dogs exercise, wait for exercise. A lot of medications, acupuncture, physiotherapy, incredibly important. Awesome question. Thank you. Question we have also is that my pet seems to be in a lot of pain and is not very active anymore. What should I do? Senior pets, and I have to again reiterate that we're sort of defining senior cats above 8 years of age, sort of defining dogs approximately 7 years of age. It does depend on the breed of dog that you do have, whether they be a small dog or a larger dog. When we talk about these dogs becoming unwell, we have to also realize that there are gazillions of senior pets out there that are perfectly fine, and they can be perfectly fine. They're running around like there's no tomorrow. They're happy and they're energetic. But there are a population of senior pets that are not well, and you might see when you're driving, you see the owner walking and the poor pet walking behind, trying to keep up. These guys are struggling. These dogs are struggling. They're sore. They can't keep up. They've got neck pain. They may have underlying heart disease issues that really need to be looked after. Pain in our world is we cannot and don't tolerate pain in our patients. It's a thing that if we experience pain with ourselves, we need to make sure that our patients and our pets don't experience pain. If they're not active anymore, they're in discomfort. Yes, they might have underlying heart disease or liver disease or kidney disease, but definitely they're in discomfort. They need to be seen, guys. There is so much that you can do. If you've got an 8-year-old cat that's in pain, that cat may live for another 8, 9, 10 years. Let's try and make that cat a lot more comfortable than we would normally do. We go back 5, 10 years, 20 years, we didn't have the technology that we do now. Really important. Pain should not be, to allow a pet to experience pain is not acceptable in our world. Like with us, we shouldn't be experiencing pain. There's a whole lot of treatments that are available that we can help with our patients to make sure that they're not in pain. A question which is a little bit off the topic, which is okay because we're here to ask questions, and for me to, or for you to ask questions, for me to answer them. Does FIP run in siblings? Not really a senior question, but hey, I'm very happy to address these questions. FIP is a disease that we see in cats. It stands for feline infectious peritonitis. It's a disease that's caused by a coronavirus. We often see them in younger purebred and also older purebred as well. It's thought to be a heavy genetic component. It's also an environmental component. Chances, if there's one cat in a litter with FIP, the others have a very good chance of having FIP. It's a very contagious disease. There are some breeds of cats that are more prone to FIP than others. Is it a seniors thing? No, not specifically. We tend to see it also in the kitten and the young adult stage, but it is out there. Very, very nasty disease. There's some very good new treatment possibilities on the horizon. Very good question. Guys, again, we're coming live from Green Cross Vets in Chatswood today. I'm Dr. Adam. I've been a vet for almost 19 years now. I lose track a little bit, and I'm happy to answer your questions. Please keep them coming through in your comment section. I'm happy to answer anything about seniors as well. Okay, so a couple of questions that are not senior orientated is, how often should I brush my dog's teeth? If you can brush your dog's teeth, again, not always a senior question. If you can brush your dog's teeth every day, that is really, really fantastic. The aim of brushing teeth is to remove the plaque. If you remove the plaque, you'll stop the tartar from developing. Tartar is that hard, calcified material. Stop the plaque, stop the furry material on your mouth that you might feel in the morning or at night time. Stop the furry material from accumulating. You'll stop the tartar also from happening as well. I want to talk about some behavioural changes that we do see in dogs, specifically dogs, a little bit harder in cats, that might elude you to the need to bring your dog or cat in or dog into a vet clinic. Some dogs will, and we've mentioned this before, will start to lose their hearing. They'll start to lose their visual accuracy. We know that dogs can get and do get what's called doggy Alzheimer's disease, what we call canine cognitive dysfunction. We've mentioned it before. Please don't write it off as age. It may be an age thing, but please have your dog checked out. It's really important that we ensure that their senior needs are very, very important. Of course, as senior dogs and senior cats age and they do become senior, their requirements for exercise, their requirements for diet change. There are some really fantastic diets that are there purely designed for senior pets that are different balances of carbohydrates, proteins, and fats that are really very, very helpful for our senior patients and senior pets. Okay, how are we going for questions? Some more questions coming along. Again, not a senior question, again from Kobe the Dude. Second question, when can I start running my dog? I've been told 1 year. Very good question. Depends on what type of dog you have. We generally recommend for larger breeds of dogs, medium to larger breeds of dogs, that running after about 12 months is probably the way to go. I suppose the reason behind that is their joints will stop growing, and it's a little bit easier on their joints when they're fully grown. Saying that, there's no reason why they can't go for long walks on a lead or off lead in off lead parks, running around by themselves. That's also very, very, very good to have. So if you've got a small breed of dog, sort of under about 10, 15, maybe 20 kilos, exercise shouldn't generally be a problem starting early. A larger breed of dog, Labradors, Rottweilers, Great Danes, big dogs, hold off exercising intensely until about a year of age as well. Fantastic. Really good question in terms of, again, seniors and also winter coming up. Question is from an unknown person. Unknown, as winter approaches, are there any things that we should be doing to make our older pets more comfortable? I have 2 cats over 9 years of age. So this is a very, very good question, a very, very common question, something that we face on a daily basis in clinical practice. There's a lot of work that you can do to help your senior pet in wintertime. In wintertime, their joints become sore, they become stiff. They don't want to go outside, they become reluctant to exercise. Keeping them warm is really, really important. If you keep them warm, their blood circulates easier. If they've got nice bedding, nice comfortable bedding, that's also nice. Make sure that when they're fed, you don't overfeed these dogs or cats in the middle of winter. Generally, well, with winter time, the days become shorter, the nights become longer. We leave early in the morning, we come home late at night. It's dark when we go to work, it's dark when we come home. Often the last thing we want to do is to exercise our pets. So we feed them the same amount of food, and they're fed the same amount of food without the exercise, they're going to gain weight. And that's the same thing with cats and as well as dogs. Your question refers to 2 cats over 9 years of age. Making sure their diet is good, continue to exercise, modify their exercise, make sure they have nice comfortable bedding. One thing that we do recommend is if they like to jump up on couches and beds, give them a little stepping stool or a little platform so they can jump from the floor to the platform or stool, from the stool then onto the bed or the couch. That's really very, very important to do. Guys, we're almost coming to the end of our session today in our seniors session. We've got a couple more questions that we need to get through. Please, if I can't get to a question today, please make sure you write it in the question box or the comment box down below. I will endeavour to get to them today or tomorrow. It's really, really important. Again, we're coming live today from the Green Cross Vets in Chatswood. Everything's senior today. Everything's senior. If you have a Labrador, another question, if you have a Labrador, should you walk it every day? Absolutely. There's no reason why you shouldn't or you can't walk your dogs, Labradoodle, my apologies, every single day. Some dogs are quite prone to gaining weight, so I think it's important to keep the calories down, exercising every day, make sure they get nice lean muscle, absolutely. I think we have time for one more question. And before we need to unfortunately call it a day today, a quick question again regarding a rabbit. Again, not a serious question, but it's okay. What should a rabbit's diet be, and what's the best living environment for them? Best diet for rabbit is vegetables. I think vegetables are really fantastic. Anything green apart from light leaf lettuce, anything green, any of the herbs, any of the lemongrass, mint, coriander, thyme, endive, any of the bok choy, Chinese vegetables. There's a huge range of diet available. There's only a very, very few select grains and pellets that we recommend. Avoid diets that are high in leucine as well. Living environment, massive question. I'll try and answer that question live on the feeds as well. But that's a very big question to answer, but I'll definitely do it on there. Guys, unfortunately we've have come to the end of our time. I hope you really enjoyed our time today, talking about all things senior. We look forward to seeing you again in about a month's time. Again, Dr. Adam here, coming from Green Cross Vets Chatswood, live question and answer, today's senior pets. Questions, comments, please put them in the box below. I look forward to answering them back as soon as I can. Look forward to seeing you next month. See you guys, bye for now.